I'm the co-founder of Insena Health, and we're a digital health company based here in Denver, and we're focused on weight management and, in the last few years, type 2 diabetes prevention. But what I want to go through today is some of the insights we're discovering on non-traditional ways to get your patients to want to engage in a program like this. I bet a lot of you in the room have patients that you need to get them to manage their weight as part of the overall protocol, and it's a tough conversation to have sometimes. If you do get into it, there aren't a lot of really quick answers, and you might not have time. It's great hearing the MD VIP where you have more time to go through it and do those conversations. But a lot of the primary care physicians we talk to are really struggling with that. And so we've uncovered some neat ways, I think, to go about that challenge of getting the patient to want to engage in healthy eating and active living. And I want to take you through in the next 15 minutes some of the things we've learned from that. And this has come from kind of a progression over time for our company. Over the last 17 years, we began in corporate wellness and went into large self-insured employers. Kaiser Permanente was actually our beta site. So we went into their workforce and they said, hey, we're having trouble internally. Can you try to help get these obesity levels down? That's where we tested out the program. We've since expanded it to employers coast to coast, and then have gotten into health systems as a vehicle to use this. And then with some of the latest things that we're discovering, we've got a way, I think, to even do it at out in the field and reaching people wherever they are. So that's what I'll take us through. This, in its simplest form, is the intervention that we have used, and it's changed a lot, as you can imagine, in 17 years. We didn't have smartphones back in the mid-2000s when we were getting this started, but the basic premise was, let's go out and make a totally different offer to the patient, to the employee, to try to get them to want to take action. And the method was, tell me about yourself. Tell me if you're a vegetarian, if you're a meat eater, do you have a gym, what do you struggle with, what are your barriers and motivators? I'm going to coach you every day with these small nudges, with literally 365 days a year, and I'll show you that. And then we're going to measure your progress. And the way we've done the measurement has really expanded a lot in the last decade. But the most fundamental one is I'm going to measure your weight and use this visual way to do it to make sure that it's you on the scale and it's not your dog standing there, or you don't put one foot on the floor. And then I'm going to give you a reward, give you a financial reinforcement based on that. And so the nature of that conversation right out of the gate shifted from, I'm trying to really get their attention from these numbers are out of control and we've got to get you to do something, and instead saying, hey, this is something that I want you to invest in for yourself and I want to reward you for it. And when you see some of the demographics of who we've ended up engaging, it's pretty neat in terms of who we're resonating with. And we're not just saying, I'm going to reward you if you can get your weight down and good luck, go starve yourself. No, we're giving them a daily regimen of all the major things that you would imagine. And going through what their exercises are, how to eat, how to talk to a coach, even mindfulness meditations are now part of it. We're giving them a breakfast and a lunch and a dinner every day, a mid-morning snack, a mid-afternoon snack. It's coming from a registered dietitian. They can say, I want to eat gluten-free vegetarian, and we'll give them that. And we just nudge them along. We give them a shopping list at the beginning of the week. We give them their workout every day. And most of our members, our patients tell us, I don't have access to a gym, so I want a way to do this stuff at home. So we've made it very simple. We prompt them, say, hey, it's time, take a little bit of energy for yourself and let's make some change here on your exercise.
I'm Jenna, here to lead you through today's 15-minute run.
We tell them
Great work on making yourself
plug in their earphones and just listen to our coach.
Take control of your health. Throughout your workout, I will be referencing an effort scale from 1 to 10. Think of a level 1 as taking little to no effort, something you could continue all day. Think of a level 10 as your maximum output, like a sprint that could only be maintained for a short amount of time. Keeping your personal scale in mind, let's get started with a little warm-up. Here we go with a level 4 jog.
And this progresses over time. Most of our people start in the beginning phase. They're doing 15 minutes. They're coming off the couch. They're not ready to do anything intense. But over the course of a year or longer, we gradually start increasing the frequency, the duration, the intensity, and hopefully get them to stick with this and not get burned out. We go through and we prompt them once a week and say, hey, take 10 minutes to de-stress. Click here, plug those earphones in again. We give them a custom meditation. We might talk them through guided mindful eating, and sometimes we'll say, put a raisin in your mouth, and for the next couple of minutes, we want you to just slow down and taste what that feels like, taste the texture of it, and not just be in the drive-thru cranking through a Happy Meal or a Big Mac. So trying to do some of the things that are on kind of the stress and resilience side of things. We're doing some new expansion into that. But it's all built around a concept of the patient's busy, they're distracted. When they have 5 minutes of free time, they never go look at a health portal. They'll go look at ESPN and see, how bad the Broncos are doing this year, or whatever their issue is. So we built it that way and said, no, we're going to come nudge you every day. Give us permission. Tell us if you're a person who likes a text message or an app notification or an email, and we'll give you something that you need. This is what the total experience in the patient eyes looks like, and then I'm going to jump in and show you some of the data behind this and some of the insights.
Welcome to Incentive Health, a digital weight loss program that works around your schedule. We provide all the tools to get you there, like a free wireless smart scale, personalized meal plans from a registered dietitian, guided workouts from Coach Kenna. We even include guided meditation so you can de-stress and enjoy the journey. Want to skip the pricey gym membership and the time in the car it takes to get there? No problem. Our membership includes a resistance band so you can work out from the comfort of your home. 71% of our participants weighing in 2 or more times lose weight and keep it off for multiple years. Best of all, you get paid to achieve a healthy weight. Upon receiving your Incentive Health Smart Scale, just launch the Incentive Health app and perform your first weigh-in. In just 45 seconds, you'll create your first healthy selfie. You'll be prompted to complete your coaching profile by identifying your nutrition and exercise preferences, as well as your unique barriers that always seem to get in the way. As you weigh in on your Smart Scale, you will be creating a visual gallery of your success over time. Trust us, you've never seen anything like this. You will actually see the
This is amazing. People are weighing in more often than we ask them to, and I think we're getting to something intrinsically rewarding for them.
For every 5% or greater weight improvement. The more you lose, the more you earn. And if you get stuck, your Incentive Health membership gives you unlimited access to a personal trainer. That's just a call or click away. Here at Incentive Health, we make health room.
So that healthy selfie piece that you saw embedded in the middle of it is kind of the first big surprise that we found in this journey of an audit tool that we put in to make sure we could measure what was happening and not look at self-reported data. Turned out to be a behavior change support tool and a retention tool, because we were doing those incentives just every 3 months, and the requirement is in a year you only have to weigh in 4 times. Quarter 1, quarter 2, quarter 3, quarter 4. But most of the people that are weighing in do it more than once a quarter. They'll do it once a month on average. Some people do it. I'll show you an example of a guy that's done almost 200 weigh-ins over 5 years. And no one ever does health screenings more often than you ask them to. Usually you're twisting their arm to get them to do a screening. But I think one of the insights with this is getting to something that's intrinsically rewarding to the member, to getting them to say, okay, it makes sense, some of the investment I'm making in myself, I'm eating better, I'm moving more, is showing me something that I really like. So here's kind of what some of the patient reactions have been to that. So when we give out that home kit, we include a little shirt and say, hey, if you want, show us your transformation. And they'll, as soon as we started putting those in the kit, we started getting people without any coaching of what to do. They started doing these kind of funny, power poses. And they're not, if you look at the people on the slide, these aren't the athletes. These aren't the guys going to the CrossFit gym. These are our demographics, mostly women. It's 80% female. And it's kind of neat just to see, okay, we're onto something with this kind of a different way to tee it up. And I'll talk about how this has transitioned to diabetes prevention here in a moment. But yeah, so this kind of blew us away, seeing what people would do. It was just giving them a shirt, giving them the band. Another thing that surprised us is we put on a feature on a Saturday afternoon a few years ago called Brag to Facebook, to say if you want, you can share the results. And we did it on the quietest day of the year. People started doing it the Saturday we did it. It was Saturday like today. And what we started seeing is this kind of social contracting happen. And a bit of this, I'll talk about some of the referral sources next. But we started seeing people get their support group and kind of their peer support going around it. And when we look under the hood at the data, the people that tend to use this feature have a longer duration of effect. Their magnitude of weight loss goes up. And it's not for everybody, but for more and more of the pockets of your patient demographic, this is a kind of a community that they use. So, from our view of looking out, we've seen, you can get someone's attention with this, financial reinforcement. And if you stretch that out over time, I'll show you some of the long-term effects next. You can try to get, hopefully, some durable behavior change on following better eating patterns, following better exercise. This visual reinforcement part, we just discovered serendipity, I'd say. We didn't intend it for that, but it turned into a retention approach. And then the social reinforcement is kind of that last piece of the puzzle where if you can bring those together, I think you can get something that can hopefully stay with the patient after they leave your office. And in the other 180 days of the year, if they're going to see you again in 6 months, what are they doing? We've done a neat program taking this out to the public with Kaiser Permanente and have put about 100 of our kiosks, and a bunch of employers have come out and used it, put this across the state of Colorado. And over 100,000 individuals have come out and said, yeah, I want to be in that program. And when we've looked at the data, we've done about 500,000 of those healthy selfies so far. And I'll show you some of the neat insights that have come out of that data next. We had a paper published in the Journal of General Internal Medicine looking at a 48-month group of people in that population, about 40,000 participants. What they found is the demographic is what I'm describing, someone in their 40s with a mid-30s BMI, very much someone who needs to, in addition to a lot of changes, look at some lifestyle changes to help them succeed. When we got the people in that group to weigh in at least twice so we could see a delta in their weight, which is about half the group, about 19,000 of them, 2/3 of them lost weight. Half of them getting to the 3% change, and about a third getting to that 5% change, where you start seeing something clinically significant. We can get a 5% change in someone's body weight, but at what duration? Is this someone doing a juice cleanse for 3 weeks, or is this something longer term? So they looked at the first visit to one of those scales and the most recent visit, and they found 1.7 years was that average duration of effect. So at that point, it feels like we're getting a durable behavior change. We got their attention with this interesting catalyst of, hey, do you want to get rewarded for taking care of yourself? But I think it transitions to something intrinsic that they're resonating with. And what Kaiser Permanente here in Colorado said to us is they were looking in at our data. We were showing them the mindset of the participants, where they're coming from, but they focused in on this person in their mid-40s with in the obese category and said, these are pre-diabetics. You're attracting the very type of individual we're trying to get engaged in some of our diabetes prevention efforts. And then when we looked at the the duration of effect and what we're doing with those folks, they said you're getting what the CDC recommends for their national diabetes prevention program. So can you use Incentive for pre-diabetics? Can we send them into this program? So we then developed a specialized version of our kind of core behavioral economics platform, but putting in, if you study the CDC's diabetes prevention program, they've got this great curriculum. It's typically 26 classroom sessions. We've done video versions of that. So someone on their phone can just pull their phone out. Our diabetes educator takes them through day by day. But we also use the behavioral economics piece of it. So we think we've got kind of a stickier way to maybe get them to do the behavior change. The Colorado Health Department here locally has just brought us into a new 5-year campaign that they're rolling out. And we're the only virtual diabetes prevention program that they're putting in their recommendations out to the people that they're marketing to. So we're excited to see if, by not even touting the message of prediabetes and diabetes, can we get some of those people to start making lifestyle change, behavior change around this? And one of the things we're interested in doing to try to raise the bar a little bit in how some of these national diabetes prevention programs are structured is usually it's all self-reported data for activity, for how many active minutes did you have a week. And that's good to get the self-report, but we've had some neat data on people wearing an Apple Watch or a Fitbit or a Garmin. We've got a kind of a device agnostic gateway in our platform that lets 100 different apps or devices be tracked, and then we do incentives if you can get those step counts up. And some of the analysis, researchers at Virginia Tech looked in at people wearing a wearable in our platform versus some random samples of folks not wearing them, and they found just a big surge in how often they weighed themselves, how much more likely they were to get to a 3 or 5% weight loss. So we just got notice about 2 weeks ago that we got a study getting published in the Translational Journal of the ACSM that goes in and looks at that data. And so what we're trying to do is take the self-reported physical activity and supercharge it with real measure from the wrist. And for people that have that, can we see, hey, that's an even stronger indicator of getting to make this change and just be more active. Here's a neat example. The University of Nebraska Medical Center just we installed one of these kiosks at a clinic in North Omaha at the end of the summer. And we're running a study there. We had a lot of really big traction with African American participants in the Colorado program. And so they put it in a predominantly African American population. And you can see how the branding works, so that the kind of a call to action while they're sitting in the waiting room and sitting around looking at this, trying to get them to jump in and take a step with it. But I'm going to show you some of the stats on what we're finding as referral sources. And the presence of this in that waiting room area, I think, is an untapped opportunity to get someone who's just sitting there killing time to maybe recruit themselves to get into a behavior change program. We've always had to do it. This is kind of one of the newer developments with this kiosk approach. This, and we started 17 years ago. Again, no smartphones. All we had were Windows computers. Now it runs on an iPad and a little sleeker design. But we've also changed it up and said, hey, we've got a way to do this in the home and meet someone wherever they are. So we've got that wireless scale approach. And that's a piece of kind of a whole home monitoring ecosystem that we're trying to kind of team up with what you can do diagnostically when you're in a clinical setting, but what can you also do in the other 364 days of the year when they're remote. And if in some cases, if we can get a bit more frequent measurement of some of these metrics, do we get better outcomes? And so we kind of see the coupling in a lot of our deployments, where we use the physical presence like this to try to get people while they literally walk by the break room, walk by the cafeteria, but also reach them in the home and give them some of the things that we see as barriers. I don't have any equipment. I don't have access to a gym. I don't have time. I've got 3 little kids. I don't have time to go to a gym. Well, we say that's no problem. Let's do this, step by step in your living room with a simple band. And this is one of the interesting insights. If you look up here, this is looking at referral sources of how people have joined the program. And the top ones are, my employer told me about it, a friend told me about it, or I just walked by the kiosk. And that's from in the short compressed amount of time that we usually have working with patients, this can kind of recruit them on their own while they're just sitting around and looking at it. And also the social aspect of it, the friend and family member part of it. We've seen that a lot. There's this benefit to the initial patient who is kind of sharing their healthy selfie if they're motivated that way, and they get a bit more social contracting and they stay with their change. But it's also a bit of a recruiting tool, maybe to someone else in their family that says, "Oh wow, Todd's made this change. Maybe I should take a look at what he's doing." Another example I want to give, just looking at kind of a durable behavior change in a long-term view. This is from a power company in Little Rock, Arkansas. They're one of our clients that they monitor big power networks. It's a male-dominated workforce. It's typically a tougher audience to engage. We found just when we're going in and trying to do some of these wellness-type prevention approaches. But we've got almost 2/3 of their workforce enrolled in the program, and they're in their 6th year in the program. And they have fairly low turnover, but they get new employees that join. So the average duration for the entire cohort is 48.9 months, looking at their weigh-ins on this approach. And if you look at this gentleman on the right, and you can kind of just hear in his own eyes, what might be resonating, going through his mind of why he said, yeah, I'm going to follow this daily plan. I'm going to follow these nutrition guidelines. He was stage 3 hypertensive. He's the one that's done 195 weigh-ins. And talking to this group about what they've done previously in methods like this to try to get lifestyle change, they could never get people to come and do screenings. And they would do a health fair like once a year. This wasn't a big lift. Now they've got people coming in, and we've got this right by their cafeteria in that deployment. So it's neat. Like you get people, we often hear partners say, hey, let's put this in the gym. That's a great spot. And we always say, no, that's probably the worst spot. You're going to only get the guy like Dr. Boone who's out running around and is really in shape. Put it where the person that might not take the initiative to get involved and put it right in front of them, because it tends to just get their attention when they walk by. So 195 weigh-ins kind of blew me away. So just wanted to put that out there as some different, maybe non-traditional things that might be going through your patient's mind when, we always hoped if we just told them how serious it was to have this, some of these stats out of whack, that would just get them to change. Some people it does. Other people leading with a different approach that kind of appeals to maybe what they selfishly want to do. And we look inside at some of the data, we see people that say, I want to feel better about myself, I want to fit into my older clothes. Instead of trying to change their motivation, maybe you can meet them where they are and get them to engage in the program. So any questions? Yes?
Who pays for this, the employer?
Yes, usually it's the sponsor, so the employer, the health plan. The new version with the home scale, we've actually got consumers paying themselves. They're paying $29 a month. That includes the equipment, and we pay the incentives out of it. So it's whoever is the sponsor typically.
For years, I've tried to work with Todd and Jack, not only in sort of advising in this arena, but how could you get this even more effectively through large medical clinics? And my practice has a lower number to actually tie into it. But I think any of you who during the break would want to talk to Todd about this, I think it has tremendous opportunity to extend incredible information to groups that are needing it and attack the obesity and diabetic surge that's coming forward. Great presentation. If there are any other questions, we'll take, yes, one more.
How many individuals are represented in the numbers that you're showing, or is the vast majority, that $29 a month, does that disincentivize the piece?
We've done programs in corporate deployments where instead of it being free to the employees, like we typically recommend, the employer says, hey, I want the employee to have skin in the game. And that definitely pushes down the engagement level significantly. In the case of this kind of new offering where the individual can say, yeah, I want this because my employer doesn't offer it, or I don't want to go to Weight Watchers, or I want to do something that's kind of at home. We're just at the starting line with it to see, it's kind of priced at a mode that's cheaper than a gym, cheaper than some of the Weight Watchers plans, but it's definitely, depending on your charter, and if you're looking at population health, and you've got kind of a prevention budget, we get way bigger uptake when you